The most common symptom for acid reflux is heartburn, and it's especially worse after you eat at night, or you're lying down, or after having spicy food. That's usually the most common symptom. Other common symptoms are excessive belching and burping. Some people can experience a sour taste in their mouth. Rarely people can also have like hoarseness of voice, chronic cough because of this, asthma-like symptoms. Some people can experience nausea and rarely vomiting if it's really bad. But how do we differentiate it from other GI issues? If someone's having persistent abdominal pain or severe bloating or early satiety, unable to tolerate and keep things down, that's generally not a sign of acid reflux, and that definitely needs to be evaluated further. The junction between the esophagus and the stomach has a muscle sphincter called the lower esophageal sphincter that acts like a one-way valve, usually helping the food move from the esophagus to the stomach and not the other way around. And when this mechanism is affected and you have reflux of food and acid from the stomach into the esophagus, that is what we call as acid reflux. It is normal to have acid reflux occasionally once in a while, but when it's a persistent and a consistent problem, that's when we worry about acid reflux disease. Most common reason why people have acid reflux is lifestyle factors, consuming food really late at night, lying down immediately after a heavy meal, eating a lot of spicy food, or consuming alcohol, smoking, excess chocolate. These are all known risk factors from a lifestyle standpoint. There are certain medical conditions that predispose to acid reflux: stress levels, obesity and being overweight, having a condition called hiatal hernia, which is a portion of your stomach in your chest wall. Certain medications which can increase your acid levels can also predispose you to acid reflux. There are medical options for treatment for acid reflux. We have different classes of medications like histamine blockers, which reduces the levels of histamine and acid production. Most common medication what we use in our practice is what we call proton pump inhibitors, and it acts in a different mechanism with the goal of reduction in your stomach acid levels and indirectly reducing your acid reflux symptoms. Surgical options have been there for a very long time. One of the most common surgeries is what we call as fundoplication. If you have this condition called hiatal hernia, which is basically a portion of your stomach moving into the chest wall, and it acts as a pocket where acid is constantly present, and you have a free passage for reflux into the esophagus, and that can be surgically fixed also. Long-term acid reflux can cause inflammation in the esophagus, what we call as esophagitis. That can cause difficulty in swallowing and also pain during swallowing. And when there is long-standing inflammation, that can lead to scarring and fibrosis in the esophagus, leading to what we call a stricture or narrowing of the esophagus, and that can also cause difficulty swallowing. And the inflammation over time can predispose you to a condition called Barrett's esophagus. It's a known precancerous condition of the esophagus, and if left untreated or unidentified over time can lead to esophageal cancer.